All right. Good morning, everyone. I hope that I am live. Good to go. All right. My name is Becky Holt, and I serve as the executive director of All in Mountain Brook. And I am thrilled to be able to present or to host today for All In to host today's webinar series. All in Mountain Brook is an organization here in Mountain Brook, Alabama, that truly works together as a community collaboration to enhance and protect the lives of the youth and really to address any situation and any issue that may come their way. So we have a founder of All in Mountain Brook, Dr. Dale Wisely, who will be presenting today's webinar on ADHD and substance abuse. And so I'll pass it off to Dr. Wisely to introduce himself and tell you a little bit more about him and what he's going to be speaking on today. So thank you
Thanks
for joining us.
Thank you so much. Oh, welcome everybody. I'm glad you're here, and thank you for being here. Thanks for your interest in this topic. So I'm Dale Wisely. I've been, as I've been saying lately, I've been licensed in Alabama as a psychologist for 42 years, which is freaking me out, but that's another story. I practice mostly child and adolescent clinical psychology for about 25 years. And in more recent years, I've not been practicing, but I've been still very involved in the whole ADHD area, and trying to do a lot of education about it for parents and professionals and different kinds of audiences. I have a long-standing interest in ADHD, and so that's enough about me. In fact, that's too much, but let's go. So ADHD and substance abuse, what's the connection? And then I want to talk a little bit about also about sort of parenting for prevention or things we can do to try to prevent this. So I'm tempted to say, here's our basic message. I was tempted to say, here it is. And then anybody have any questions? But I'm going to elaborate a little bit. So first, ADHD is absolutely a significant risk factor for the development of substance abuse and addiction. And I'll show you data about that. The second big point is that if people up through the teens and into adulthood, if they have ADHD and they get good, consistent, persistent treatment for ADHD, that risk of substance abuse is probably, I left out a word there, probably dramatically reduced, and maybe even not unfair to say it could just about be eliminated. In other words, good treatment of ADHD greatly mitigates the risk of people developing substance abuse problems. However, that's the good news. So the good news. The bad news is far too few people with ADHD get good, consistent, persistent treatment, which I'm going to say a little bit more about. So that's the frustrating thing about this. For people with ADHD, the development of substance abuse problems is really a needless thing, because if they were to get the kind of follow-up care and that they really need, then it's highly unlikely to develop, and we'll show you that later. I'm not going to do a lot of references to the references. I'm not going to talk about the research sources that I have, but if there is something, I gave you a couple of examples here, but if there is something that we talk about in this webinar that you would like to know more about and like to see some research on, feel free to email me and I'll do what I can to provide that. I'll give you my email address later. Okay, so let's get into the link between ADHD and substance abuse, and what do we know about it? Well, the best data we have is that if a person has ADHD, they are something like 2 to 3 times more likely to misuse alcohol or nicotine, marijuana, other drugs, if you compare those people to control groups that don't have ADHD. Another way of kind of stating that is adults with ADHD, 3 times more likely to have a substance abuse disorder. So that's a substantial link, obviously. Another way of thinking about this is if you look at people who are in substance abuse treatment, about 25% of them have ADHD. And that you compare that to something like 5 to 10% of the general population that has ADHD. So people who are in treatment for substance abuse problems are much more likely as a group to have a history of ADHD and to have ADHD. With teenagers, for reasons that I just don't have time to elaborate on, but if you look at just teenagers who have identified serious substance abuse problems, 50% of them have co-occurring ADHD, even more than adults. So that, you know, I'm always impressed with how strong that link is, right? But a great question to ask is, why is this? I mean, why is there such a strong link between ADHD and then later developing substance abuse problems? So I think probably it's fair to say that if you had to pick the number one culprit, what is it about ADHD that tends to contribute to this? The main culprit would probably be impulsivity. Now, not everybody with ADHD has the set of symptoms that are related to impulsivity. We all know that, generally speaking, there's people with ADHD that have impulsive, hyperactive behavior when they're kids, looks more like impulsivity in many respects. And then we know there are other people who have what's technically still called ADHD, but it's ADHD primarily inattentive type. And the common language is they kind of have ADD without the hyperactivity, impulsivity. So that's for those folks, we know a lot, the people who don't have impulsivity, they got ADD, they're not hyperactive, they're not impulsive. We don't know as much about their risk for the development of substance abuse, but we do know that the impulsivity that is present in so many people with ADHD is a big contributor to the substance abuse problem. Well, why? Well, impulsivity means that you make quick, risky decisions without considering the consequences, right? Or a tendency just to try something impulsively just on a whim. So you're at a party and somebody says, you want to try this pill? And you say, sure, right, without thinking it through. Trouble sticking to limits. So people who might say, pardon me, I'm going to go to this event tonight and I'm going to drink, but I'm going to stick to 2 beers or whatever that is. People with ADHD, if they are impulsive, they are less likely to be able to stick to the limits that they kind of set for themselves. So, you know, push through those limits. Another issue is that the impulsivity that goes along with so many people that have ADHD can contribute to faster progression of use. So they get started and they're more likely to kind of accelerate their use with all those kind of related consequences. And then there's, you know, some people talk about a kind of an ADHD personality, quotes, sorry about the air quotes, that they tend to be, as a group, they tend to be sort of seeking out sensations and excitements and, you know, excitement and novelty and so forth, which unfortunately can include, you know, spinning the wheel and trying different kinds of alcohol, drugs, or whatever it is, right? So there's that kind of aspect of the personality with ADHD. Okay, a second big feature, way to connect ADHD with substance abuse is that sometimes the substance use is self-medication. So drugs and alcohol, as we know, can temporarily address restlessness. I may have put in an extra syllable there, restlessness, anxiety, difficulty focusing. So drugs and alcohol can temporarily sort of moderate the symptoms of ADHD. So people often are using drugs to sort of self-medicate their ADHD. And I'm going to say a little bit more about that later. This appears to, when people with ADHD start doing alcohol or drugs, it appears that that's not so much about recreational highs. They're not trying to get high. They're trying to feel normal. So I think that's an important thing to remember to help us avoid being judgmental about this. If you have ADHD and the more severe it is, the more this is true, you just don't feel normal. And so it's the use of like things like marijuana, so forth, is not so much about trying to get high, it's about trying to feel normal. So that's another way of sort of stating the issue of self-medication. We have surveys that say that 70% of youth who have ADHD, who engage in substance abuse, that's what they say. They say it's about self-medication and not about recreational highs. So a quick soapbox thing here, and I'm going to get back to this. If self-medication is part of the problem, what can we do to help people not treat their own disorder? So if treating their own disorder is a problem, what can we do to help them avoid that? And the answer is give them better treatment, encourage more treatment, encourage them to stay in treatment. So good clinical treatment, as I've already alluded to, could take care of this problem for a lot of people. They wouldn't need to self-medicate if they wouldn't need to self-treat if they were getting adequate treatment. This is something I feel strongly about. Let me go ahead and say this. I believe that the majority of people who have ADHD from childhood into adulthood just do not get the treatment they need and they deserve. So with all the talk about over-treating ADHD, I'm convinced that under-treatment is a bigger problem. And that's a separate issue from whether or not we're over-diagnosing ADHD. But I'm talking about in the population of people that have ADHD, over-treatment's not an issue. Under-treatment's an issue. Thanks for that. Okay, another link. Sets of reasons why ADHD and substance abuse are linked. So let's think about the academic and social problems that are common in people with ADHD. So academically, poor concentration, poor organization, some of the other features of ADHD tend to contribute to poor grades and or disciplinary issues. Those in turn contribute to stress, poor self-esteem, and so forth, which then leads the person to look for ways to escape those feelings of stress, the poor self-esteem issues that go with that. And so the escape then, one way to try to achieve that escape from those feelings is by substance use. Socially, okay, so a lot of times people, not always, but a lot of folks with ADHD have trouble fitting in socially, have trouble maintaining relationships. And this is pretty well documented, by the way. So the younger they are, well, I should say, by the time they get into the teens and then young adulthood, because they have trouble maintaining healthy relationships, they're more likely to get involved with sort of deviant peer groups that are edgy, and more likely to get involved in substance abuse. So the lack of social success that's common to these folks tend to cause them to hang out with an edgier group. The edgier group's more likely to be involved in substance abuse. Okay. And then another reason we might explain why there's such a strong link between ADHD and substance abuse is that people with ADHD are very likely to have co-occurring disorders. So a couple of examples of that. In childhood, A common disorder that goes along with ADHD is so-called oppositional defiant disorder, which I like to refer to as the you say tomato, they say tomato sort of disorder. You can't make me, oppositional defiant. If that's not addressed, then it has a tendency to move into conduct disorder in adolescence, which is breaking rules, getting in trouble with the law, being a frequent flyer to the assistant principal's office at school for disciplinary issues, right? So that transition, by the time somebody gets into significant conduct problems when they're young adults or teenagers, then they're more likely to get involved in substance abuse. But also, people with ADHD are more at risk to develop depression and anxiety. So those are more common in ADHD youth and in adults with ADHD. Depression, anxiety are more common than they are in the general population. And by the way, that may lead to more self-medication with drugs and abuse rather than getting adequate treatment for their depression and anxiety. They may be smoking pot or using pills or drinking too much or any number of things just to try to feel better. Back to that point about self-medication is not about getting high, it's about trying to feel normal. Okay. And then I think this may be my last point. You'd think I know since I wrote the slides, but there probably is a family history and genetic thing that's contributing to this link. So ADHD is highly genetic. Now, there are people who have ADHD that don't get it by way of genetics, but ADHD is highly heritable, inheritable. I don't know what it is, genetic. So, uh, so it may also turn out that the ADHD and substance abuse disorders may have common genetic factors. And then we know that kids with ADHD, people with ADHD, are more likely to have parents who have substance abuse disorders, and youth who have substance abuse disorders are more likely to have parents with ADHD. So there's probably a genetic link to all this as well. Okay. Just want to make a quick note about the fact that nicotine, so nicotine and tobacco, particularly strong connection between ADHD and subsequent use of nicotine and tobacco products. And why? Well, part of that is because nicotine is a stimulant. It briefly improves concentration and mood. Now, we all know about the downside of of nicotine and tar and all the tobacco products, but it has a stimulating effect. It's not a particularly effective way of addressing a person's focus issues, but it will do that, right? But I would we have multiple studies now to tell us that individuals with ADHD have much higher rates of smoking. Get this, 40 to 50% of kids with ADHD will become daily smokers by adulthood. Now, if you're skeptical about those numbers, I get it, because those are high numbers. But let's say that those studies are off by half. So let's say the true number is 25%. That 25% of kids with ADHD become daily smokers. That's enough to be shocking, considering the health consequences of daily smoking. But the data are that it's closer to something like 40 to 50%. Just shocking to me. It's in that category of things I say lately that are shocking, but not surprising. Not surprising in the sense if you know enough about ADHD, then you kind of get why that may happen, but it's still kind of shocking to me. Okay, so one way to kind of frame this whole question of the relationship between ADHD and substance abuse is to kind of go back and talk a little bit about what is ADHD, and don't panic. I'm not going to get into the details about this, but what do we think of as kind of being the core deficits of ADHD, and how might those connect? So problems with attention, and impulsivity, hyperactivity. So in the DSM-5, and in our best understanding of ADHD is that being impulsive and being hyperactive are pretty much the same thing. The way psychologists and psychiatrists are talking, researchers are talking about this, is what those both impulsivity and hyperactivity have in common. Sort of the overarching concept is behavioral inhibition, a lack of behavioral inhibition. So quickly, what that means is, as all of us go through the day, we are constantly checking our own behavior. We're inhibiting our impulses. So if my boss says something that irritates me, I have to inhibit the impulse to yell at him or slap him, right? If I see something beautiful and shiny in a store, I have to inhibit the impulse to just, stick it under my jacket and walk out with it, et cetera, et cetera. So all day long, we are tamping down our impulses, right? And so hyperactivity is about being a fifth grader in the classroom, having the impulse to get up and walk over to the aquarium. And most kids who don't have ADHD would say, nah, I'm not supposed to do that right now. But the child with ADHD gets up and goes. And then he gets up and goes to the next thing. So the hyperactivity is driven by the lack of impulse control more than you needed to know. A third, and probably more than you wanted to know, a third core deficit, this is somewhat debatable, but I think it's fair to say, is that people with ADHD as a group have trouble regulating their emotions. And I'm going to say a little bit more about that in a minute. So let's start with inattention, and let's be very brief about this. I don't believe that this feature of ADHD, difficulty paying attention or focusing, is really a significant contributor to the link with substance abuse. But I want to say this though. If we say people with ADHD are more likely to develop problems with substance abuse, well, grumpy grandpa here might say, are you trying to tell me that his trouble paying attention in math class is what got him using alcohol and drugs? Okay. So here's the thing. ADHD is so much more complicated than just not being able to pay attention and maybe or maybe not being hyperactive. So so that sort of attitude of it is an example of how people's lack of understanding about ADHD causes all kinds of trouble. So anyway, that's enough about that. Let's move on. Okay, so we've already talked a little bit about impulsivity. So just to kind of underline this more, I'm not in the habit of reading text to you, but I'm going to do that in this case. So for individuals who have psychiatric disorders like ADHD, mania, the manic part of bipolar disorder, substance abuse problems, personality disorders, high levels of impulsivity are often involved, and they are associated with all kinds of things. High risk of pathological gambling. Just saw a news story last night, I think on NBC News, about the sort of growing problem of addictive gambling. Substance abuse, poor interpersonal skills, car accidents, incarcerations. So the impulsivity that comes from not just from ADHD, but from several other psychiatric disorders are major drivers in all kinds of bad things. So let me just quickly address a sort of a pet issue of mine, accidents. It's not our topic, but I just want to quickly talk about this. I've been fascinated and worried about this for years. So just to illustrate this, people with ADHD are far more likely to have injuries, unintentional injuries, right? So an example of that is a 16-year-old person in their first year of driving is something like 3 to 4, maybe even as much as 5 times more likely to have a motor vehicle crash than adults are. So 16-year-olds, let's say 4 times more likely to crash a car in that first year of driving. If a 16-year-old has ADHD, they're about 4 times more likely than their peers to be in a motor vehicle crash, right? And much of that is about impulsivity. It's also about not paying attention. If you have trouble focusing and you're driving, obviously that can cause difficulties. Anyway, that's a sidebar. Okay. So emotional regulation, I'm not going to say a lot about this, but it means that on average, all things being equal, people with ADHD are quicker to get angry, quicker to develop sort of hostility. They're more emotionally excitable, more reactive emotionally to things that happen to them. They have difficulties if you have a negative feeling or a negative emotion. A lot of times, if we're worried, we can shift our focus to something else that's more positive to kind of offset that. People with ADHD have more trouble doing that. They're more likely to have difficulty with being motivated, so sort of being self-motivated. So emotional dysregulation is common in people with ADHD and just kind of adds to the difficulties that may lead to things like self-medication by way of substance abuse. Okay. So with all that in mind, let's talk about checking my time here. I'm actually in danger of being on time here. Wow, that never happens. My standard joke is I would love to hear the end of one of my talks because I never get to them and I bet they're just genius, but I might be on track. Okay, now I'm getting myself behind by talking about that. Let's talk about treatment. So I've already mentioned this, but I need to say, I think maybe twice, but the third time. If people with ADHD got good, consistent treatment, then the risk of them being involved in substance abuse would be dramatically reduced. I'm going to come back to that yet another time. And thanks for your patience. So just to let you know, last year, a year ago, in the very august publication Pediatrics, Peterson and Trampush and others did a paper, published a paper where they did this massive thing, which is look at the studies that have to do with what treatments work for children, teenagers, and to some extent adults, young adults who have this disorder. And this is who have ADHD. And this is a really fun, not fun, but I think worthwhile summary of what they found. Okay. So you have treatment that tends to produce large improvement, some that produce moderate improvement, and some that can produce improvement, but the effects are lower. Okay. So kind of really helpful, and maybe helpful, but not as powerful. Okay. So I need to nuance this a little bit in a minute. So one thing this mega study, meta-analysis sort of led to is that, first of all, the stimulant medications, Adderall, Ritalin, et cetera, are still the first line of treatment for ADHD. And in this analysis, the family of medications that we might call the Adderall family, and they are in fact amphetamines, okay, which is a little scary to some people, tend to actually produce better results than the Ritalin family. So you have basically two big families of stimulants, the Adderall family and the Ritalin family. Methylphenidate, Adderall, amphetamines, Ritalin, which is methylphenidate and variations on that. And so this analysis kind of gave the Adderall family a little bit of an edge, but it would be a big mistake to say that means everybody ought to be on Adderall or Adderall products. So it still has to be individually tailored. And the other, I apologize for getting in the weeds here, but the term moderate improvement's a little bit misleading because moderate just kind of sounds weak. It can be based, depending on the individual, it can be substantial improvement. So don't be misled by that large versus moderate improvement. The non-stimulant medications like Strattera, and there's a new one, and I haven't memorized the name of it yet, can also produce improvement in people. But it is still true that the stimulant medications are, for most people, the first line of treatment for ADHD. Now, under that, there's, it says, all right, so an advantage of these is they're available. I'll contrast that in a minute with some of these others. They tend to be lower cost than some of the other treatments. Now, there are side effects, of course, that can occur. Probably the most common one, according to this meta-analysis, is appetite loss. But there are others. I will say to you that in my kind of long experience with this, for most patients with ADHD, side effects are really manageable. They're not scary, they're not dangerous, they typically can be managed, but they're there, for sure. Okay, so in the category of things that, the way I like to put this is, these interventions can be somewhat helpful for some people. So it's not, the results, according to research, are not nearly as robust as what you get with medication. So psychosocial treatment, now that's a vague term, but one way I would put that is there a role for like counseling or psychotherapy for people with ADHD? And I think the answer to that is yes. It's not that counseling or psychotherapy cures ADHD. It's not going to make the symptoms of ADHD go away. But counseling can certainly help a person live with the disorder, deal with the feelings that come from having this disorder and the hassles of all that. It might well be, we don't know this, but it might well be something that would help someone with ADHD not develop substance abuse if they're getting that kind of support. So it's helpful, but it's not something that, in other words, if you have ADHD and all you get is psychotherapy, that's not enough. That's not going to be enough. Various kinds of parent support, being, parent training, those kinds of things can be helpful. Neurofeedback, which I wish I had more time to talk about, can be effective for some people. It is time consuming, costly, and in my opinion, should not be held out to the public as a substitute for medication. And it sometimes is held out to the public as a substitute for medication. So just briefly, I will say, if people ask me about neurofeedback, and I know I'm not even getting into what that is, for those of you who don't know, I just don't have time. But I often say, if you have the time and the money to do it, then I wouldn't advise people not to do it. But I do feel strongly that the research data are not to the point that it should be offered to people as just another option that's as effective as medication. That data just is not there. Okay. So all of those things, kind of looking at the bottom row there, they're far less available. Medication's available most places, right? To most people. I think that's fair. But these others really are more time consuming, more expensive, and a lot of people live in places where you just don't have access to that, to parent training and neurofeedback and psychosocial treatment and all those kinds of things. I left out nutritional interventions. It wouldn't be fair to say there's nothing to that. There's some data about the value of nutritional interventions, but it's another thing where, to be blunt, it's just a mistake to try to manage ADHD just with diet. And I wish I had more time to talk about that, but I don't. So, all right. So again, I apologize for reading text to you, but this is kind of a summary from this big study published a year ago. Pardon me. Clinical guidelines currently advise treatments of youth, people over 6, which is not to say there aren't occasions when you treat people under 6, but it's clearly from school age on up with FDA approved medications. So clinical guidelines currently advise treatment with FDA approved medications, and that's supported by this big review. Furthermore, FDA approved medications have been shown to significantly improve broadband measures, okay, and have been shown to improve disruptive behaviors, suggesting their clinical benefits extend beyond improving only ADHD symptoms. So, translated into English, when people are successfully treated with these medications, they not only improve focus, they not only improve impulsivity and hyperactivity, but they improve a lot of other things, like disruptive behavior and so forth. So I'm an unapologetic advocate of medications for ADHD, always have been, and the data are absolutely there to back up that claim. Okay. So I think I've got time to do this. So if you work with people who have like parents of people with ADHD, or if you work with people who have ADHD, or you are a person with ADHD, or you know somebody with ADHD, et cetera, et cetera. There are things people are often reluctant to use Ritalin, Adderall, and stimulant medications. Parents are often reluctant to go there and so forth. And I have learned from experience there are a number of things that we can say to these people that will help them feel better about using these medications. So here's what I think helps. First of all, people really benefit from understanding the way stimulants work in the body, which is they are water soluble. So some medications that we take are get into muscle and fat tissues and stay there, and takes a while to get out of the body. If somebody takes, like if I had taken a stimulant pill this morning, I didn't because I don't have ADHD, but if I had, then it would start working quickly. And then by the end of the day, somewhere up in the end of the day, that medication has cleared itself out of my body. So that's a built-in safety factor. If a child or an adult takes a stimulant medication and they have, let's say, a really bad, uncomfortable side effect, and you stop taking it, it goes away. It's as if you never took it. It literally goes away by sometime late in the day, depending on which medication. So when people say, I'm afraid this medicine is going to build up in my child's body, it just can't. Cannot, right? Gets in, gets out. So an analog or a way of thinking about that is like aspirin or ibuprofen. You take it, it works for several hours, it quits working, right? It's like the next day it's almost like you didn't take it. That's not exactly true, you know what I mean? Okay. So that seems to help people. Another thing is I'm worried that it'll change my personality or my child's personality. Okay. That's kind of related to this common side effect of stimulant medication, which is it's improving focus, and it's almost like it improves focus too much. So it's like, that's the most fascinating doorknob I've ever seen, right? Just too much. So sometimes that's just a consequence of having too high of a dose. or just the wrong medicine. Okay. So I wish I had more time. The whole question of what we mean by it changing personality. Okay, let me just do this quickly. So let's say I have a teenage patient and we start him on medication and he comes in and says, well, I'm doing better in school, but it's changed my personality. I said, what do you mean? And they say, well, I used to be like so much fun and everybody talked about I was a class clown and I was, okay, if he was the class clown and now he's on medicine and he's not the class clown anymore because he's doing his work, is that a desired effect or a side effect? Right? Has to be considered. Now, I do think, I know that there are people who take these medications and it does kind of dull their personality. That's fair, but it's also addressable. You can deal with that, by changing medications and so forth, so it shouldn't discourage people. I'm afraid it's going to make my child a zombie, which is kind of like that personality thing. It cannot. That's what a child's zombie looks like. Your child is not a zombie. Okay. So that's probably that thing about over focus, which can be addressed usually by backing off the medication. Okay. All right. So this last one's a very key point. You might hear your Aunt Susan might say, oh, the reason people with ADHD have a higher risk of turning into being involved in substance abuse later is because they start taking these drugs for ADHD, gets them used to taking drugs, and they just start using other drugs. That's just not true. Okay. So stimulant treatment of ADHD that is not what increases the risk of substance abuse. It's not that taking Ritalin or Adderall means later people are just going to segue into other medication. In fact, as I've already alluded to, and I'm not even done alluding to it, if we adequately treat the ADHD, that risk of substance abuse goes away. So stimulant treatment doesn't contribute to substance abuse. It actually reduces the risk of substance abuse, a point I've already made multiple times and I'm not done yet. Thanks for your patience. But I just want to say this. I think the parents of folks with ADHD really do have all kinds of reasons to be frustrated. So this guy says, I don't want my child to take medications. Or I want my child, if he's going to take medication, I want him to take the smallest amount possible. And that's just a lack of education about it, a lack of understanding, maybe asking the person, what is it that, that you're concerned about, and then they can talk to you about it. And very often the concerns people have about using medications for ADHD are just based on misunderstandings or mythology or whatever. And then, maybe they want to get their kids involved in some kind of behavioral treatment and they find insurance won't pay for it, or they don't live in a place where that's available, et cetera. I don't know how to work with my child's school for ADHD, and that's a legitimate problem. It takes a lot of work and advocacy to work those things out. So just a acknowledgement that it's hard. It's not only hard to have ADHD, but it's also hard to be the parent of a person with ADHD. Okay. A couple of other things that make people feel better about using these medications. So people often say, okay, I'm worried about it stunning my child's growth. Okay. Now, this is the research on growth issues with stimulant medications that research is very complex. I have a really hard time sorting through it. Okay. But here's the short version of the best understanding I have of what we know about this. Do these medications cause the person to be less tall than they would be if they didn't take the medication? Okay. So here's what I think is true. The majority of people who take these medications will not have any growth issues. Some will. But it appears that if someone of the people who end up being shorter than they would have if they didn't take the medication, it appears to be about an inch or so of difference in growth. So somebody who is 5'10", somebody who might have been 5'10" may end up being 5'9". We're not talking about somebody who was supposed to be 6'2" being 5'7", you know. So is it a possibility? It is, but it does not appear to be an issue that's significant in terms of reduction of growth. It's not something significant for the vast majority of people. So most people who take stimulants are not going to have their growth inhibited, and those who do, it's going to be a small amount. I think that's a fair reading of the research. I've already confessed that it's very complicated data. Okay, another thing parents like to hear, or people like to hear, is trying these medications like Ritalin is not the same as committing to do it over the long haul. So and people get confused about this. It's almost like they say, well, if I start my child on medications, they're going to be on them forever. No, if you try your child on medications, they're going to be on them for 2 weeks, and then you decide whether they need to stay on them for the long term. But that's something that can always be reversed in the future. Okay. Now, the last thing that I like to talk to parents about so they feel better about medication, or talk to adults about if they're thinking about taking medications for adult ADHD, is you have to really carefully consider the risk-benefit analysis. So, are there potential risk of taking these medicines? Yes, as is true of virtually all medications. However, the risk of having ADHD and not treating it are extremely serious, including substance abuse, right? So substance abuse is just one example of all kinds of things that can happen to somebody if they have ADHD and it's not adequately treated. So that's what a lot of people miss, because if they think that all ADHD is trouble paying attention and maybe or maybe not being hyperactive, then they aren't thinking about the fact that having ADHD and not treating it really produces risk for all kinds of bad outcomes in life. Some of which I don't have time to, most of which I don't have time to get into. Checking my watch here, I don't mean to be rude. Okay, let me do this soapbox thing. I've been advocating this for a very long time. I firmly believe that people with ADHD ought to see a qualified professional, probably a mental health professional, or it could be a physician, a non-psychiatric physician, as long as they're just kind of up to date on ADHD. But you ought to see, everybody ought to see a professional on a regular basis, but not necessarily a frequent basis, no matter how well they are doing. Okay, now here's my argument for this. Okay, so let's say I have a patient and he's 10 years old and I treat him for ADHD, or I get him treated for ADHD, right? And follow up with him and he's just doing great. Then I would say to the parents, please let me see him if it only means twice a year or 4 times a year, whatever it is. Let me see him no matter how well he's doing. All right, now why? Okay, because let's say I see him for 3 years, 4 years, he's doing fine. We hang out for a visit, play cards, it doesn't matter, okay? So if he turns 15, he's 15 years old, and I mentioned that people with ADHD are more likely to develop depression, anxiety, and substance abuse disorders. So if his mother calls me when he's 15 and says, uh-oh, he seems really depressed, then I'm able to pick up his care right away. He knows me, I know him, we have a relationship, and he can get to me quickly, right? Which will facilitate whatever needs to be done to help treat his depression, anxiety, substance abuse problems. If, on the other hand, I treat him when he's 10, I say sayonara, let me know if you need anything. He gets depressed when he's 16, and I got to get the chart out and remember who he is. I got to start over again. We haven't maintained a relationship. So please, if that makes sense to you, please advocate in the spirit of the checkup. Look, ADHD is a very serious disorder, and I've got type 2 diabetes. So I see my doctor on a regular basis, not frequent, but a regular basis, no matter how well controlled my blood sugar is, et cetera, et cetera. So thanks for letting me preach about that. Okay. Another issue, and I think we're going to be good. Another issue is that if you have ADHD, whoops, I think I'm on autopilot here. I'll fix it. If you have ADHD, you're maybe perhaps as many as 70% of people with ADHD will have another diagnosis at some point. Okay. So I've already mentioned those: depression, anxiety disorders, and those can lead to self-medication. Okay. All right. I want to show you this because I find this kind of heartbreaking. And this study is, man, I'm so aggravated because I forgot to turn off my auto advance, but I'll handle it. Sorry. Okay. So yikes. All right. So this was a study of 2,000 girls, and they were between 8 and 13. So sorry, I'm so sorry. All right, look at this table. Co-occurring disorders. So they have ADHD, some of them have anxiety disorders, depression, oppositional defiant disorder, conduct disorder. Look at the number of ADHD girls that have anxiety disorders and compare that to non-ADHD girls, and then go down the list. 10% depression if you have ADHD, only 3% if you don't have ADHD. And this happens to be a study of girls. Oppositional defiant disorder, which I mentioned earlier, 42% if you've got ADHD and you're a girl, 5% if you don't. And then conduct disorder, 13% versus almost none, right? I hope that makes sense as I quickly go through it and am distracting you by this auto advance. Let me try to read this text to you. Sorry. Girls with attention deficit hyperactivity disorder are at higher risk than girls with without ADHD for multiple mental disorders that often lead to cascading problems such as abusive relationship, teenage pregnancies, poor grades, and substance abuse. So disturbing. So it's hard to overestimate the risk that ADHD produces for people, particularly when it is not treated. Okay. So here's a list of symptoms of adult ADHD, and we know, most of you probably know about these. I'm not going to read them to you. These slides will be available to you. But I do want to talk about adult complications of untreated ADHD, which I've been alluding to. People who have ADHD, and if it's not treated or not adequately treated, are more likely to drop out of school or do poorly in school, more at risk for depression, self-harm, and suicide. Suicide rates are higher in people with ADHD. They have more trouble with relationships, including multiple marriages, failed close relationships, more divorces, more remarriages, substance abuse, which is our topic today, difficulty keeping a job, getting jobs and keeping jobs, financial problems, more likely to be arrested and incarcerated, more likely to have unplanned pregnancies, I mentioned that earlier, and more likely to have accidents or unintentional injuries, driving, motor vehicle crashes, head injuries, and others. Okay. So when ADHD is inadequately treated, you have more trouble with self-esteem, depression, anxiety, chronic stress, difficulty in relationships, job, negative parent-child interactions. Let me pause on this one for a minute, if I can. Yikes. So if a young person has ADHD, their parents fuss at them more, get aggravated, punish them too much, those things are not trivial. Okay. Drug and alcohol misuse, and increased mortality rate. So the latest data I've seen is that if somebody has ADHD and it's not adequately treated, their lifespan on average is about 6 or 7 years shorter than for people who don't have ADHD. And then lots of problems with, sorry, with lots of health problems that don't seem to have anything to do with ADHD, like heart disease and diabetes. People with ADHD more likely to have heart disease and diabetes. And you say, what is that all about? Okay, what do you do to keep from developing heart disease and diabetes? You exercise and you eat well and you manage your stress better. All those things require focus, organization, and good control of your impulses. So those are just two examples of health problems that are more common in people with ADHD when they are not adequately treated. I know I'm a broken record. Okay. Most people with ADHD are untreated or inadequately treated, those two. They often will try low doses and stay too low on the theory that I want to get by with the least amount of medication, which we don't do for anything else. We don't do that for antibiotics, for infections, for seizures, but we have this minimalist attitude based mostly on the false belief that these medications are dangerous. Okay, often people will try a medicine, try another medication, and then give up. We have a lot of different preparation medications for ADHD, and sometimes it's the fourth or fifth one you try that works, but people often will stop after a couple. Sometimes people will not persist with their treatment, not stay in treatment, even when it does work. So people with ADHD have a tendency to drop out of treatment even when their treatment's effective. And then the other thing is there's a lot of other kinds of helpful interventions like behavioral treatment that really can help people, but they're hard to get. They require people with ADHD tend not to benefit from a little bit of behavioral treatment, need a lot. That's expensive, time consuming, and depending on where you live, may not even be available. Okay, if we want to do something about this, I am going to finish on time. Here's some things we can do. First, we need to do early diagnosis, early intervention of ADHD, and not do minimal care, but do optimal care. And there's no evidence that stimulant medications increase the risk for substance abuse later on. Okay. We need to have more people aware of this link between ADHD and substance abuse so they can try to prevent, right? So we just need to do education. Like to say to parents, you should know that people with ADHD are more likely to develop substance abuse problems, but if they get good treatment, stick with treatment, that risk is greatly mitigated. We can help by trying to enhance their coping skills, okay? And then we should never stop looking for the emergence of co-occurring disorders. In other words, knowing, as we talked about a few slides ago, that suicide rates, depression, anxiety, and substance abuse are more common in these folks, then one of the reasons they need to stay in care, continue to get care, is so that they can get intervention, have that detected if that in fact does show up. Okay. So I'm done, I think, and miraculously on time. Me finishing a talk on time I think it's like in the book of Revelation, that end times are coming. So thank you very much for tuning in, and hope I can be helpful. My email address, which I promised to show you and then I didn't, is dalewisely@gmail.com. And my last name is Wisely, Dale Wisely @gmail.com.